Very warm good evening to one and all. Welcome back to the today's session. Today our guest speaker is Dr. Niharika Jain ma'am. Today's topic is regarding the Ophidia group in homeopathy. Now coming on to the small introduction regarding the madam. Ma'am has did BHMS in LBS Homeopathy Medical College, Bhopal, and ma'am has did post graduation from Government Homeopathy Medical College and Hospital, Bhopal in MP. Ma'am has been practicing private practice since 8 years. Ma'am has been worked as senior research fellow in CCRH since June 2023 to August 2024. Worked as a research assistant in research study entitled Comparative Effectiveness of Pre-Identified Homeopathy Medicines in Asymptomatic COVID-19 Individuals Receiving Standard Treatment Protocol. And ma'am has also been attended workshops, various conferences also. And ma'am is a associate editor in Homeopathy Heritage magazine and assistant editor in Hanuman Homeopathy Sandesh and reviewer in peer-reviewed index Journal of Integrated Medicine and Case Report, and member in Akhila Bharatiya Chikitsa Association, New Delhi. We welcome you, ma'am. The session is hand over to you. Thank you, ma'am. Thank you all.
So much, doctor, for your kind words. So now I can start.
Yes, ma'am. Yes, ma'am.
Okay, so hello everyone, and today's topic is navigating the Ophidia groups in homeopathy. So everyone knows that there is importance of every kingdom in homeopathy. So homeopathic having three main kingdom: plant, animal, and mineral. So today we are talking about sub kingdom. So this is the sub kingdom of animal kingdom. So this is the Ophidia group. कि Ophidia group के क्या qualities होते हैं? How we can understand the Ophidia personality in our OPD, in our clinics, in our hospitals. When we start to treating the patient, it's very important to understand patient reactions, patient conversation. So in this way, it is very important कि how we can understand the remedies. So today's topic is Ophidia. So everyone is understood is Ophidia is mostly is reptiles. And anything start to before, I want to gratitude to my group. Because of this, today I am here. So I'm just evening to all my group. So first you understood कि what is the animal feature. Because अगर मैं बात करती हूँ कि what is Ophidia, so Ophidia is a sub kingdom of animal kingdom. So अभी आपको ये पता होना चाहिए कि एनिमल किंगडम के क्या क्या इश्यूज होते हैं, क्या उनके कैरेक्टरिस्टिक होते हैं, तभी क्योंकि वो जो क्वालिटी है वो उनमें होगा क्योंकि वो भी एनिमल्स हैं. सो फर्स्ट वी अंडरस्टैंड एनिमल फीचर्स. सो मोस्ट इंपॉर्टेंट आपको याद रखना है, दिस इज द कोर फीलिंग ऑफ एवरी एनिमल्स or every animal's personality. There is a issue of survival, the survival of the fittest. There is meaning of कि वो अपने survival के लिए कुछ भी कर सकते हैं. How I can survive in this environment. अभी मैं क्लासरूम में हूँ, I am in my college also, I am in my office also, I am at my home also. अगर मेरे को मेरे अकॉर्डिंग एप्रोप्रिएट इन्वायरमेंट नहीं मिलेगा, प्रॉपर इन्वायरमेंट नहीं मिलेगा, तो मैं कैसे सर्वाइव करूंगा? क्योंकि आई वांट टू सर्वाइव, एनी हाउ आई वांट टू सर्वाइव. सो देयर इज अ इश्यू ऑफ सर्वाइवल. सो देयर इज अ कोर फीलिंग. if you are seeing your materia medica and there is a Ophidia group, you want to understand the deeper pattern of remedies, then you know if it is belongs to the animal kingdom, there is a issue of survival. जो उनका इश्यू ऑफ सर्वाइवल अगर वो कोप अप नहीं कर पाते हैं, सो देयर इज अ डिसीज कि एनी हाउ आई वांट टू सर्वाइव इन दिस हाउस, एट एनी कॉस्ट आई वांट टू सर्वाइव इन दिस कॉलेज. कुछ भी हो जाए, मुझे अपनी क्लास के साथ कोप अप करना है, मुझे अपने बैच के साथ कोप अप करना है, बट आई एम नॉट एबल टू डू दिस. So there is a gap because I'm not able to do this. I'm not able to cope up this particular things or particular situation. वो जो बीच का gap होता है, there is a time where the diseases arise. Your vital force going to dearrange. Because how now you can connect your organ and also. There is a mind and body and soul. तो यहां से सर्वाइवल नहीं हो पा रहा पेशेंट को. अभी उसकी नई नई शादी हुई है किसी भी लड़की की, XYZ किसी की भी, और उसे न्यू हाउस में जाना है, वो अपने इन लॉज के घर में गई है. देन शी वांट टू सर्वाइव एनी हाउ. रिएक्शंस कुछ भी हो सकते हैं, बट अभी उस घर में उसको रहने की आदत, उसके वहां के कल्चर, एनवायरमेंट, वहां के रूल एंड रेगुलेशंस, वहां के कल्चर्स, इंटरनल इंटरपर्सनल रिलेशनशिप्स, शी वांट टू सर्वाइव. So this is the deeper pattern and this is the core feeling of the animal feature. And there is a many words. When if you are seeing any patient in your clinic or OPD, if you observe their conversation with you or they are just आपको कोई story बताएंगे, then you observe their words and their mechanism, their action. I am victim and my boss is aggressor. वो मेरे साथ ही करता है, पता नहीं उसे मेरे से ही प्रॉब्लम क्यों होती है. There is some issue with me and my boss. If the child is school going, there is issue with the class teacher or subject teacher or maybe the principal also is there. I don't know why it's happened to me only, ma'am. But whenever I'm going my school and my teacher only point out to me, we don't know. Who is surviving is also maybe the victim. It is kind of prey. छोटा animal हो सकता है because they having some issue, me versus you. So prey and predator, they having feeling in high and low. वो मेरे से ऊपर है, मैं नीचे रहूं, उनके मार्क्स ज्यादा आते हैं, मेरे कम आते हैं, तैयारी तो मैं भी उतनी करती हूँ. There is some competition. They are superior, I am inferior. They having more power. कितनी भी कोशिश कर लूं वो मुझे डोमिनेटिंग करता ही है, मुझे वो, मैं डोमिनेशन में ही जी रही हूं. So now your mind is going to Staphysagra also. There is domination because you only catch up one word. But my dear friends, homeopathy is not like this. If you see only one word and you are just decide your remedy. You catch word and write in your note paper and ask your patient again, what is the meaning of this domination? And what you felt when you feel dominating. So after this line, they give their pattern. Then you will decide the kingdom. One word never ever decide the kingdom of the patient. This is Staphysagra or this is Lachesis or this is Naja. Strong and weak. यही है ना, जंगल में शेर है, बहुत ताकतवर है, छोटे सारे एनिमल्स उससे डरते हैं, जंगल का राजा होता है. सो देयर इज अ स्ट्रॉन्ग एंड वीक. छोटा वाला चूहिया बोल रहा है मैं तो डरता हूं, मैं कैसे जाऊं, वो तो जंगल का राजा. देयर इज सम फीलिंग dominated and dominating. So the whole theme of this slide, me versus you. So all the patient who belongs to the animal kingdom, they having issue me versus you, means in their story there is a two person. मेरे साथ कोई और भी है जो जिससे मेरे को प्रॉब्लम है. मैं मेरी सास, मैं मेरा टीचर, मैं मेरा पति. So there is an issue with someone else. To go the animal kingdom, you understood the sexuality. They having higher sexuality. They are very attractive. When they start to talking, आप उनकी बातों में खो जाएंगे. They are very attractive. They have to wear very attractive dresses also. When they do the makeup, it's very attractive. Attention. Camouflage. What is the meaning of this particular word? The way they have the surrounding. So they, वो बोलते हैं ना, गिरगिट अपना कलर बदल लेता है. वो सेम वर्ड आपको देखना है कि एनिमल जब भी कभी भी होगा ना, वो सराउंडिंग के अकॉर्डिंग ही चेंज हो जाते हैं. सो यू आर नेवर स्पॉटेड देम. दे हैविंग वन क्वालिटी. colors. They are very, very like interesting for every color and especially bright colors. Musics or dance. Bright color to attract attention or exact opposite of very dull color. So now this is the point you have to put attention. Every remedy having two polarity. A person is, मैं आपको बोल रही हूँ कि there is a animal having a bright color attractions or they like bright color. But if you are seeing in your patient, maybe patient having another polarity or patient आपको बोले कि मुझे तो dull color पसंद है. So the exact opposite reaction is also you can found in the same remedy. So me versus you, what is this meaning? Fight to finish. खत्म कर दूंगा, आज तेरा काम खत्म. कंपटीशन, या तो मैं रहूंगा या तू रहेगा. अब इन सारी बातों को हाउ यू अंडरस्टैंड इन द पेशेंट कन्वर्सेशन, हाउ वी कैन सी द ह्यूमन एक्सप्रेशन, बिकॉज वी हैव टू टॉकिंग अबाउट द पेशेंट्स. Generally, we are not talking about the animals. In your OPD, the cat is came and giving the kiss taking. It is not like this. Okay. But what is happening? The patient is came with the same impression or same pattern. He belongs or she belongs to the animal kingdom. So what is the human expression? So I am stronger than you. I am weaker than you. They have this kind of line. Again, if you want to understand the human expression, someone is doing something to me. वो मेरे लिए ऐसा कर रहा है, वो मुझे नुकसान पहुंचाएगा. Someone is doing some harm to me. I will kill you. Who wins? Who survives? He is after me. If you understand the whole line, then you understand the pattern of this animal kingdom. कि मैं तुझे जान से मार दूंगा, छोड़ूंगा नहीं. देखता हूं कौन जीतता है, देखते हैं कौन टॉप करता है. अच्छा ठीक है, तू भी देख ले, मैं भी देखता हूँ इस कॉलेज में कौन सरवाइव करता है. या तो मैं ही रहूंगा या तू रहेगा. तू मेरे बाद, मैं तेरे पहले. This kind of conversation. They are not saying कि I am in a lachesis, please give me, madam, lachesis medicine. It's not kind of this. You have to understand the conversation. If you further exploring the animal issues, there are two-sided. The one-sided and outside. One inside, one outside. So inside is very bad, maybe outside is very good. Especially आपको ये Ophidia group में remember करके रखना ही है. Please remember this line. They having competitive feeling and they having a strategy. They have planning and plotting. They won't survive anyhow and at any situation at any cost. So they having inside is very bad intention, but they people looking very good outside. So you admire them. Sometimes you have confusion and you haven't admired them. Now, basically, now we see the Ophidia cases. So issue find in an animal or Ophidia cases. If you are seeing a Ophidia cases, how you can see the issue? So there is an issue of survival, threat of life. They can also very deceitful, malicious, aggressive. They will kill me, cut me, bite me, rive me, tear me. अभी आपको कुछ अजीब सा नहीं लग रहा? ये सारे वर्ड कैसे चल रहे हैं जो अजीब से हैं. कुछ भी सॉफ्ट नहीं है, कुछ भी ब्यूटीफुल नहीं है, कुछ भी मेरे कानों को सुनने में अच्छा नहीं लग रहा है. बिकॉज दे आर एनिमल, सो दे हैविंग दिस काइंड ऑफ लैंग्वेज कि मैं तुझे मार दूंगा, मैं तुझे काट दूंगा, इसको चीर दूंगा, मैं टीयर मी अपार्ट, बिखरा दूंगा, पीस पीस कर दूंगा. So this kind of mind they having inside. Victim and aggressor feel victimized by the people. मेरे साथ ही ऐसा होता है, लोग मेरे साथ ही गलत करते हैं. Illness, people are doing this with me. And if it is a expression in your OPD, sometime patient using a one line कि ये बीमारी मेरे को ही हो रही है, ये मेरे साथ ही ऐसा हो रहा है. सिर्फ क्यों, मुझे ही क्यों? हायरार्की, superior, inferior, they are above me, they are dominating over me, overpower me. And sexuality and attractiveness, they are a need to attract attention, and these personality are attractive in their behavior and appearance, feeling dirty about themselves. आप ऑब्जर्व करना, इफ द स्पीकर इज ऑल्सो लाइक मे बी बिलोंग्स टू एनिमल किंगडम, आपको लगेगा उसका लेक्चर बहुत अच्छा था, बिकॉज दे आर वेरी विविड, दे मेकिंग gestures, they are very attractive, their appearance is very look, their teaching style is also very impressive, because they want to attract, they want to put the attention. Competition is the key to survival in an animal world. Split, there is a two different side of such personality, the animal side and the human side. Because they belongs to the animal kingdom, definitely they having animal side also. So you observe in society how animals is behaving. अभी कुत्ते को पता है कब काटना है, कब नहीं काटना, कब अटैक करना है. How you behave with this animal, the roadside animals also sometimes. So exactly, human is also having the same thing. Ki one side is animal and another is a human side, and the way they feel about themselves is often reflective their expression, which may be by human beings. Human beings are so cruel. आपको आके बोलेंगे अरे ये लोग बहुत खराब है, बहुत इनको दया भी नहीं आती है, बहुत क्रूएल होते हैं ये लोग. So now you think, अभी यहां से डिसाइड नहीं, you never decide the kingdom, you wait for it another, how you feeling this, what happened, what kind of thought you have to come again and again. I jump at them, I'm not good enough. Connection with the source, so they having fear. Here we are talking about connection with the source, maybe it belongs to the, like I says, or Naza or Cascavella, Tortolas Cascavella. So they having fear with particular source also. If you ask the fear, they are telling you the same fear ki I have very much fear with the red and yellow, black and yellow kind of snakes. You understood? Okay. Who's this? Black and yellow. Or they are very fascinating, very interesting, very exciting for particular source. And they also saying aversion to animal. Again, the very key point. Another side of the remedy. They are saying they have like this, maybe they are saying I don't like animals. Jealousy. And the need to belongs to group. How to know sub-kingdom? So if you want to know any sub-kingdom, you have to know the exact modus operandi, habits of working. If I say in a Hindi, there is a karya pranali, karya vidhi, how you performing this. So first is very important to understand method of attack or method of defense. Now we come the part of characteristic of the snakes. So the characteristic feature of the snake is the limblessness. Limbs nahi hai. Poisonous gland is a modified salivary, and the parotid gland is very poisonous in the animals. Provide defense against the predator. So this is the hemotoxic, neurotoxic, cytotoxic, myotoxic. This is the type of snakes, venoms. Other specific features of snakes, jaw flexibility and wide gap. Because of the jaw flexibility, they open their mouth is very larger, and they can take the larger prey inside. How they attack. Chemosensory organ, Jacobson organ and fork tongue, which sense particular in the ear. कैसे वो स्मेल करते हैं, कैसे वो अंडरस्टूड करते हैं कि इस पे अटैक करना है. How they understand? There is an organ, they have test their tongue and they have sense in the air. They can sense the vibration from the ground. आसपास क्या हो रहा है, they are very observant. And sensitivity at the thought level. Snake defense is run and escape, first line defense. If you understood in a human expression, the patient is also said to you that whenever any situation is come, I'm not able to cope up this situation, I want run. Anyhow, I want to leave this. Because their first defense is the run and escape particular situation or things. Few defensive methods are more specific to snakes: squirting a stream of blood from eyes, spitting venom, adopting defensive posture like spreading their hoods. There is a asker, hissing, attack deflection or mimetic behavior, misdirection or head hiding, and dry run. So this is very common. If you see the snake, it is very common. All those their defense mechanism, they are not attack in a first time. They are giving you warning. And this warning, if you are not understood, definitely they will attack. So if you understood in this human life, there is also the some kind of people, they are giving you warning. कि इस टाइम मैं तुम्हें वार्न करना हूं, आगे से ऐसी मिस्टेक मत करना. अगर तुमने मेरे साथ ऐसा किया तो मैं तुझे कहीं का नहीं छोड़ूंगा. It's the warning. Sometimes in defense mechanism, they are behaving very mimetic behavior. Sometimes they misdirect to you also. But if you are not understand, definitely they will make plan. They attack you with the planning and plotting. Attack, poison, constrictions, and they rely heavily, stealth, and surprise. Now you remember this word surprise. अगर आपका कोई फ्रेंड डेफिनेटली बिलोंग्स टू द ओफीडिया ग्रुप, आपको नहीं पता चलेगा वो आपको किस पॉइंट पे आके अटैक करेगा. हो सकता है फॉर दिस पर्टिकुलर अटैक ही विल मेक प्लान इन द होल ईयर December 28. This is the day of the annual culture in my college. In front of all the people, I put the slap for my friend. Because last year in the December 28, he put me slap. So this kind patience they have because they are very, very, very sharp and they are very intelligent. So the two main strategies, sit and wait. आराम से वेट करो, मेरे दिन भी आएंगे, मेरा जब टाइम आएगा ना तब तुझे पता चलेगा. और another is active hunter. On the spot, I will kill you. Human expression of the snake, feeling defenseless and at a disadvantage, vulnerable to attack. Plotting, planning, scheming are very important to snakes. Violent, cruelty, torture, unfeelingness. So I think now this is the point. Here you understood the human expression. Sometimes they are using this kind of word, feeling defenseless or disadvantage. In society where one can see the snake-like survival strategy, mafia, underworld, terrorism, war, crime, politics, corporate, magic, fraud, position of power, kidnapping, bombing, hijacking, hostage, commando type of action. If you see all the people strategy, work, modus operandi, then definitely you understood how they survive in for the survival, how they are putting their action. So now here we understood. We start with the Ophidia group remedy. This is the Bungarus. So the kraits are highly venomous snake, about 15 to 16 times more poisonous than a common cobra. Okay, and this is the most lethal serpents. So type of Fungerus, there is a Fungerus crassulatus, common carrot, or Fungerus fascicatus. So there is a bandit crate. Before I took this example, if you ask your patient about the dream or fear, sometimes patient giving the source. I have particular fear with this black and yellow kind of a snake. Then after you make the whole case and make the totality, maybe you will find the Bangaras. Behavioral attributes, venom is highly poisonous, creates as sign or peaceful. Through their Venus is highly poisonous. So this is the uncommon feature of the Bangaras. You have to remember this, that they are very shy and they are very peaceful kind of a snake, in spite of they having highly poisonous venom comparative to 15 to 16 times of cobra. They are not easily provoked. They bite only if you are vexed greatly. आसानी से वो प्रोवोक्ड नहीं होंगे, वो आपको अटैक नहीं करेंगे, वो आपके साथ गलत नहीं करेंगे अनटिल एंड अनलेस आप उनको बहुत ही ज्यादा तरीके से गुस्सा, एंगर, वेक्स्ड फीलिंग करा दो. Snake handler mentioned that except at night they are easiest venomous snake of handle. सिर्फ इनका जो एक्टिव टाइम है वो है नाइट. Even at night when they are active, they try to avoid human contact as far as possible. So in this kind of study, you understood the remedy also. If the patient belongs to the Vangerus pattern, definitely they are active at night, and in spite of active, they are avoid human contact as possible, as far as possible. If your best friend suddenly decide that she doesn't like you 1 week, and then the next week she want to hang out again, she is being fickle. So this is the right example for this. Bangaras individuals are very open, unrefined or frank. In spite of the openness, they are not fickle-minded, are quiet and sharp. Sometimes you are not understood their personality. Because if you see the example, suddenly your friend decide, I don't want to like you 1 week, and another week she want to talk to you and she is a hangout again. So you have confusion, but this is their nature. So if you are taking a story in your case taking also, so you have to connect all those points, how patient is behaving. Clinically verified, those drugs are neurotoxic and have a very good action on the central nervous system. And in the nervous system, it is cause infantile paralysis and the poliomyelitis. Nucleus of the remedy, infantile paralysis, acute polioencephalitis and poliomyelitis, and persistent dreams of black and white banded snake. So I think in this point, you clearly understood what is the importance of dreams and what is the importance of the fear. Why we ask? Because they are coming from your subconscious. So sometimes they are very near to source. Activity time, Socrates are active at night. That is natural in habits and relatively passive during a day. That's we are asking the aggravation. आपके मोस्टली कंप्लेन कब एग्रेवेटेड होते हैं? नाइट में. एंड आफ्टर इन ड्यूरिंग टाइम आई एम कंफर्टेबल विथ माय कंप्लेन्स. बस रात आते ही मेरी कंप्लेन्स तो बहुत एग्रेवेशन होता है. So in this point you clear your miasma also. If it is night aggravation, this is syphilitic miasma, or evening to night maybe psychotic syphilitic. But you understood the remedy also, which remedy having this kind of particular things, they are most active at night, but they are relatively passive in during the daytime. as soon as the crate bites, the patient complains. So what is the patient complaint? Acute abdominal pain, altered level of conscious, sinking feeling, drowsiness, blurred of vision, diplopia, dysphagia, and dyspnea. So in all those complaints, you also think the vangerus. Now elapse. So red on black, friend to jack, and red on yellow, kill a fellow. So they are fairly meek snake unless disturbed. When bothered, the coral snake often rattle its flatting, elevating the tail and emits a popping sound with its bent lining. This is the sign of warning to enemies. A snake is hibernate during a winter, typically around the November, and comes out at the start of summer. So if you see this slide also, again you understood the mechanism of the patient complaints. How patient is having the complaints also. They are normally active the temperature between the 55 to 85 degree approximately, and they are active during hot sunny days. हर साल समर में मेरे कंप्लेंट्स बढ़ जाते हैं. I observed doctor last 5 years say कि my complaints are mostly aggravate only during summers, especially when the sun on the top, hot sunny days. At higher altitude, they are active during a day as a night are too cold. When the temperature is not very cold, they can be crepuscular, nocturnal, and diurnal. On extremely hot day, they are mainly active at night also. So there is a two polarity again. They are active during a hot sunny days, high altitude when the night are cold, on extremely hot days. So that time also they are mainly active at night. See the match, there is a tubercular to syphilitic. Fear of friends, unsocial aversion to company. If you see the elapse, there is a fear of rain. बारिश से डर लगता है. Unsocial, मुझे नहीं अच्छा लगता लोगों से बात करना. मैं अपने घर पे ही रहता हूँ. मुझे ज्यादा लोगों के बीच में उठना बैठना पसंद नहीं है. Aversion to company. Desire for sweetened buttermilk, salads or orange. Blacklessness of discharge from the disintegration of the blood. Coldness of part. When you touch your patient, the hands or feet or any part of the body, so you can see there is a coldness of part. Fear as if something terrible is going to happen. कुछ तो भी होने वाला है. बहुत डर लग रहा है मुझे. कुछ तो भी खतरनाक सा होने वाला है. Dreams of falling. ऊपर से गिर रहा हूं मैं. Delusion falling into the pit. एकदम से ऊपर गिर रहा हूं और अंदर घुसता चला जा रहा हूं. Such. Now you observe this kind of things. If the patient, sometime, if you observe your patient, if it is definitely of the particular disease, they making the gesture also कि वो ऐसे लगता है मुझे सपने में मैं एकदम से ऐसे गिर जाता हूँ. Such. They having some time of gestures also. You have to observe. Right-sided affections. Craving for sweetened buttermilk, meat and sour cream, oranges. Aversion to oranges also. Desire, craving is also there and aversion is also there. This is the key point. And banana. Thirst. Intense thirst with coldness in the chest. Aggravation after drinking. Urine. Strangely, thick urine with red sediment. Stools are loose, black, frothy, yellowish, watery. So in what conditions we can use this elapse? Angina, dysmenorrhea. You ever think elapse is for the dysmenorrhea? But you understood the pattern, then definitely you will also think out of the box. Because we have some set of remedy. We see only kind of this. Please just open your box. So out of the box remedy you can think when you understand the patterns. When you take a cases very carefully, then you have to understand whole the pattern, how patient is going in their lives. Esophageal spasm, hemorrhage, peptic ulcer, sinusitis. So now, if you see in your mind, one remedy came palladium, and a labs having some kind of similarity, but the both belongs to the different kingdom. If you see labs is animal, so labs having the feature of animal kingdom, but palladium belongs to the mineral kingdom, but they having the same symptom similarity. Desire to have good opinion of others, because palladium belongs to the row fifth. So the row fifth is for the art. Want to do something new. So the palladium having the desire, having a good opinion from others. The labs is also having seek good opinion of others. Palladium people feel neglected if other do not having good opinion about them. Hence, they even go out of their way to do things please the opposite person. So now you understood how the palladium feel. If the people is not appreciated to me because there is a longing desire or flattery desire. Flattery desire is the palladium if you open the repertory. So there is if you are not appreciating to them, if you are not having good opinion about them, they are feeling neglected, or they are going out of the way for please the person. Desire for flattery and longing for good opinion of others is the score of the palladium. So now in your mind with confusion, sulfur is also want appreciation and palladium is also want appreciation. So this is task for you. Definitely in the last I will give you my email and you email me. What is the difference between the appreciation desire for the sulfur people and what is there is a longing for good opinion or flattery desire for the palladium. This is for you. Definitely you work and learn. A labs person have to maintain their good opinion or else might lose their position in society. अभी हमने थोड़ी देर पहले पढ़ा है कि they having unsocial, aversion to company. And another, if you see, they want good opinion and they want to maintain their position or good opinion from society, or they having this kind of fear also, कि might I lose my position in the society. Naja. King's cobra cannot hear because of absence of external hear. Okay, so ये आपको पता होना चाहिए. But they can hear the sound that travels from their skin to jawbone. In the first, I will tell you. I just tell ना कि आपको understood करना है कि वो अपने surrounding को कैसे observe करते हैं, because they don't have external ear. But definitely they have power, they have sensitivity, they observe the senses of around. And they can also sense the surrounding by picking up vibration through the skin. Their bifurcated tongues gather the smell from the environment to detect nearby prey items while they hunt. Activity time, generally cobra prefer warm climate, or so they are active in a daytime. Sign and symptom they develop after the cobra bite. A small scratch mark at the site of sting, you can see in the image. Tissue beneath wounds become dark purple. Large quantity of viscid blood-like fluid collected in the vicinity of the wound. Intense burning initially. In about hours time, intoxicated and stupefied feeling set in. Loss of strength in the limb as well as all the sphincter leading the involuntary urine and stool. So in this situation, you can also think nausea. When the patient having this kind of particular affected the nervous system, there is a loss of strength in the limbs, and patient, all the inspector losing their capacity and leading to involuntary secretions. Able to speak or swallow from paralysis of tongue and larynx. Excessive salivation and vomiting. General deterioration and slow respiration. Difficulty in breathing with immense cardiac distress. And finally, victim develop angina, valvular troubles, and cardiac hypertrophy that eventually lead to death. So that's why nausea is very good remedy for the cardiac affection, but you don't forget he is very good remedy for the nervous system when the person feels the limbs are loss of strength, as well as the all the inspector means your spinal, your nervous or spinal somehow is affected, and all the inspector have losing their capacity, losing their power, and there is a involuntary secretion like urine and stool. Throughout the action of venom, the bitten person is conscious and suffer from excruciating headache, that particular felt in forehead and temples. Nausea again is a good remedy for the headache, and this is the excruciating headache. The location is forehead and temples. This miasm is tubercular to syphilitic, predominantly left-sided. There is a grief, antagonism of will, and anxiety. Chief highlight is sense of duty and duality, brooding over the imaginary troubles. So there is not only the two remedies, ignitia or natromir is not only remedies for the grief. There is, you can think out of the box nausea also when your patient is covering the whole totality of the nausea. The brooding over imaginary troubles, cardiac affection, excruciating headache is very common as concomitant. Every complaint, headache is better in open air and worse from overeating, mental exertion, and patient being in a warm room. Good remedy for the hay fever with the incisive sneezings, dryness in ear, nose, persistent dry hacking cough. So this is totality of sinusitis. Useful in spasmodic dysmenorrhea. Again, you add in your book or your list one more remedy for dysmenorrhea, nausea, before we are leading elapse. And there is a severe constricting pain during menses, pain from left ovary to heart. Produce neuralgia and paralysis, but not much hemorrhage. नाजा में ज्यादा hemorrhage नहीं मिलेगा. Physical journal, appetite, loss of appetite, craving, stimulant and bile, thirstlessness with dry tongue. Urine deposit in the red sediment mixed with mucus, urine of deep straw color. Bilious diarrhea with alternating with constipation. Profuse, sudden, slimy, bilious, white, green stools always precede by sudden urging and gripping pain in the abdomen. Little bit is look like Muxol Muckor. It is a stool condition. Again, you have to differentiating all the points. Perspiration, sweat, lumbar region and ankles, profuse, cold, clammy perspiration. Pain radiating left ovary to heart, worse 1 week before menses till the onset of menses. Clinical angina, arrhythmia, asthma, congestive heart failure, endocarditis, headache, migraine, hypertension, ovarian cyst. So again, comparison between the nausea and aurum metallicum. Both having a strong sense of duty, self-reproach, feeling as if neglected duty, think that one does everything is wrong, and utter worthlessness. So this is the point where the nausea and aurum met is having the similarity, but the both belongs to the different kingdom. So you not differentiate only this kind of point. Again and again, I'm just saying one word, make whole totality, then you will decide your patient कि उसे कौन सा medicine की जरूरत है. Prescriptive totality is a strong sense of duty, sense of duality. Delusion C has neglected her duty. Fear of rain, all the complaints of nausea settle in the heart, excruciating headache with all the complaint and left-sided remedy. Differentiate हमने पढ़ लिया. Now both drops. Once the venom of both drops is introduced in the body, the following processes get influenced, causing proteolytic activity, giving the rise of hard and erythematic local edema that later turns the hemorrhage. Developing into the phytolytics, these the break and excreting the serohematic liquid rich in the venom. It's also lead to necrosis and formation of abscess, which tend to get secondary infected by the bacteria. Anticoagulative action due to the effect of factor of coagulation. तो बोथ्रॉप्स के लिए आपको याद रखना है कि देयर इज अ एंटी कोगुलेटिव एक्शन ड्यू टू द इफेक्ट ऑफ फैक्टर ऑफ कोगुलेशन. द इफेक्ट इज सीन इन द फॉर्म ऑफ जनरल ब्लीडिंग इन द फॉर्म ऑफ हेमिचूरिया, एपिटैक्सिस एंड ब्लीडिंग फ्रॉम गम्स, इंटेस्टाइन एंड रेक्टम. Hemorrhagic activity resulting local ecchymosis, petechiae, and bleeding from the orifice of the white, and also some general clinical manifestation. The blood that oozes out is black or rusty looking and very fluid. These may appear within a few minutes or may take a few hours to manifest after the white. So there is a both action, the slow and fast. On the skin of mucous membrane, you can see purple spot, ecchymosis, conjunctival hemorrhage and the petechiae. Gums में भी आपको hemorrhage देखने को मिलेगा, nose में petechiae मिलेगी. Abdomen is stuffing of the abdominal muscles. Stiffness मिलेगी आपको abdominal muscles में. That may a signal of gastrointestinal or the retroperitoneal hemorrhage. There is also the tubercular to syphilitic match. Side is right-sided migraine hemiplegia. Cross-wise diagonal course भी है. Left upper and right lower, left lower and right upper. Now there is a different comparison between the sickle core and bothrops. Both are the hemorrhagic remedy. And the bleeding of sickle core is bright red or maybe dark and black. The bothrop is also having dark, black and rusty color. Sickle core again is a tend to coagulate, give rise to clotted, ropey in the tenacious blood. And the bothrop does not coagulate. There is an anticoagulation. Give rise to the mark of fluidity of the blood. Blood flow passively. There is a passive oozing. Blood flow in the jet at a least movement. जैसे ही पेशेंट मूवमेंट करेगा तो जेट जैसे ही ब्लड पूरा बाहर, ब्लड फ्लो. Gangrenous remedy, both are the gangrenous remedy. There is a sickle core, gangrenous is not deep and rapid. But both drops having the deep and the rapid dissection kind of lay in the bones of body. Concomitant, the icy coldness of the extremities, ameliorated by the cold and aggravated by heat. Both are paralysis remedies. But sickle core is for the spastic paraplegia and bothrops is for the right-sided hemiplegia. And sickle core you can use whereas the paralyzed due to the poliomyelitis, but bothrops use the paralysis due to the thrombosis and embolism in aphasia from paralysis of the larynx. Now you remember your patients when they come with paralysis. Now you differentiate the both the remedy, how it's happened to your patient. Patient suffering from the poliomyelitis or patient first having the thrombosis or embolism after he developed this kind of hemiplegia. So you know all the history, past history of your patient. Paralysis predominantly organ like rectum, the remedy is sickle core. Or the paralysis predominantly of nerves like optic nerve that causing blindness, you think the bothrops. right-sided remedy, cross-bias affections, hemorrhagic diathesis, and right-sided hemiplegia. You can think of Uttarops. Sancris, fear of sudden death, fear of persecution, elements from sexual harassment. This is the key point for your Sancris. Nowadays, very common, if the school-going child came to you in your OPDs or clinic, sometimes they are not able to say this kind of, but they having maybe in childhood sexual harassment or misuse. Or after that, they are developed that kind of symptom, maybe you can think of, because elements from the sexual harassment. They are saying fear of persecution, fear of sudden death, dreams of amorous, lascivious, frightful, vivid, horrible. Again, the dreams of rape, because they having elements from this. Cannot be shaken off during a waking hours. Aversion to domestic work. Right-sided complaints. We have only 7 minutes, so fastly we are covering. Sancris and lachesis, most symptoms are right-sided and most symptoms left-sided for the lachesis. In Sancris, difficult empty swallowing after easy swallowing of solid and liquid. But in lachesis, difficulty swallowing liquid but can swallow solid easily. Withdrawn type, not a very outgoing and expressive Sancris, but outgoing characters. Very, very expressive. If you see the lachesis personality, everyone knows it is very common Ophidia group remedy. Crotalus cascabella. It is the Brazilian rattlesnake. So, similarity between the Crotalus cascabella and lachesis, there is a loquacity, jealousy, suspiciousness, intolerance of tight clothing. Crotalus cascabella feel as if they are under influence of somebody. Or lachesis feel as if they are under superhuman power. Crotalus cascabella also hear the voice which they are tend to follow out of the fear. Clairvoyance. About bad thing they are going to take place in the clairaudience. Right-sided remedy. Lachesis is left-sided. They are also clairvoyants. They are also predict the future correctly. And they are empowered from heaven to steal or commit murders. Lachesis, this is the bushmaster. Largest of the veneous snake in the western hemisphere and largest viper of in the world. So lachesis affect, if the lachesis bite to any person, they are affect nausea, vomiting, abdominal colic, diarrhea, sweating, hypotension, bradycardia, shock, possibly autonomic in origin. Other symptom of bushmaster are explained by the hemorrhagic venom activities. So action on the nervous system is not great. No individual group of nerve cell appear in the pick out, but they affect respiration is not directly. So they having psychotic also, sora, syphilitic, tubercular. All the images you can see in the lachesis. Left-sided and initially complain, start and begin with the left side and travel into the right side. Injuries, puncture wounds, elements from suppressed discharges, alcohol, sun, grief, fright, jealousy, disappointments of love, masturbation, never well since with the climax. Jealousy and suspicion, chief highlight. Loquacity, religious, malicious, manipulative, aggressive from sleep, lap-sided. General aggravation from sleep, clairvoyance, aberration from discharges, religious. Dreams of snakes of her own death. पेशेंट को जब ड्रीम पूछोगे तो लाइकेसिस पेशेंट आपको बोलेगा आई हैव सीन कि मेरा खुद का डेथ हो गया है. ड्रीम्स ऑफ स्नेक, फ्रूनल्स, bluish and purplish appearance affected part, constriction senses especially at throat. कोई मेरा गला दबा रहा है, जब कोई किसी सेंसिटिविटी है गले में और पेशेंट उस पर अटैक करेगा तो अगर सामने वाला लाइकेसिस है तो उसको लगेगा मेरा गला छोड़ो. Cannot wear even a slightest touch to affected part in hot patient. Hyoscyamus and lachesis both having manipulative nature. Jealousy and suspicion arise out of the losing loved ones on whom they are dependent. Now you understand both the person, how the hyoscyamus is going, how the jealousy came out of hyoscyamus and suspicious nature, because the loved ones, when they are losing their loved ones, where they womb to dependent. But in the lachesis, there is a jealousy and suspicion stem out of the competitiveness to the one up, me versus in you. So there is their quest of attention. These people tend to loud, loquacious, lascivious in their behavior and talk. So thank you so much. Hope you understood the Ophidia group. You can write your feedback on at drniharikaj@gmail.com. And I want to thank you, especially inviting me here. Thank you so much, and thank you for your patience.
Thank you, ma'am. Thank you so much for enlightening us with your valuable knowledge. The session is open for question and answer session. Dear participants, you are welcome actually.
I think there is a no question answer. And
We hope they have. Yes, ma'am.
I think there is no question answer. No questions.
We hope they have. We hope they have understood well, ma'am, the topic.
We can think of it. They understood the topic very well, or they have don't understand anything. So there is only two possibilities there. But hope you understand this Ophidia group. And I will give you one suggestion. Definitely go back to your home and open your books and go through all the Ophidia group's remedy and have a clear understanding with your patients. And if you want any feedback from me about this lecture, webinar, or Ophidia group, you can write me an email. And once more, I am thankful to this platform. They are inviting me, and I'm able to share this, whatever I have little knowledge, 1% knowledge of my homeopathy. So definitely, I am happy to share with you people. Thank you so much.